Hello, my name is Rani Barra, and I'm here to talk to you today about my career in health administration. So, the duties of health administrator. Health administrators are responsible for supply inventory, distribution, and upkeep, scheduling, finance and accounting, department efficiencies. Some examples of this from the presenter we had in one of our lectures, Mr. Dean Nichols, the CEO of Northside Hospital. He talked to us about how he when he was first entering into the health administration field, he was assigned a task of developing a way for the hospital to track their wheelchairs. They were having an issue where nurses and other hospital staff could not find wheelchairs in a timely manner, or sometimes not at all. So what he did was went out and searched different methods of how to track the wheelchairs, and eventually he found a way through an app that would allow Mr. Nichols to put stickers on each one of the wheelchairs that then sent a signal that they were able to track through an application, and they were able to retain more of the wheelchairs and access them when they needed them. Example scheduling would be the administrators setting up shift times and staffing those certain shifts accordingly. Finance and accounting is basically administrators just making sure that their budgets are kept balanced, that they're not overdoing any budgets, and making sure that adequate expenditures are being made within the departments. And then department efficiencies, if they maintain these three prior points, the department would be hopefully working efficiently, and that's what they hope to do, because if a department isn't working efficiently, then it's not adequately treating its patients. So, the work environment. Work environment for health administrators is varied, as in place. Basically, anywhere where healthcare can be provided, you'll find an administrator, or you can find an administrator. So hospitals, clinics, private practices, outpatient facilities, healthcare companies. It runs almost the full spectrum of healthcare, mainly because health administrators are the management part of healthcare. So they work in that field. They work with all the personnel that they're assigned to. So if you are in charge of the cardiac department, patient transport, environmental services, food and culinary, you're going to be talking to the doctors, nurses, patient transporters, custodians, maids, environmental groundskeepers, everyone that works in your department you'll be interacting with. So this means you will be working in both an office setting and on-site setting. So you'll be walking the grounds of the hospital, you'll be walking the halls of your clinic, or talking to the personnel while they're on the job in order to gauge how they're operating, how they're working, so that you can better manage them, better apply all the logistics and supplies that you are in charge of in order to make sure that they're doing their jobs the best they can. So the education requirements for a health administrator, you would need a 4-year undergraduate degree. Definitely recommended that it be somewhere in the health field. Mine is health sciences with a concentration in biological sciences and health administration or health management. And then upon graduating, you would need to have your GREs taken and apply to a master's degree in health administration. And this is generally a 2-year program where you learn about the ins and outs of being an administrator. And then for certifications and licensure, those tend to vary on who requires them and what is required. Licensures are really just for administrators who wish to go into nursing homes, any kind of geriatrics. They would, depending on the state, would need a state licensure. Certifications, although not required, are recommended, mainly because it shows that you are furthering your education and your skill sets within the health administrative field. So you're showing your employer or your future employers that you are willing to continuously learn within the health administrative field and fine-tune all your skill sets. And so my personal timeline, I am currently in my last year of school, and so 2019 would be my last semester. I'll be finishing my undergraduate degree. I would be taking my GREs and hopefully scoring very high so that I could have the best chance when I'm applying to my different schools that I get in. And then in the fall of 2019, I will begin my classes, and then also begin joining various student organizations for health administrators, because it's very important to network within health administration. It could open a lot of doors and avenues for you and give you tons of mentorship. In the year 2020, I would be continuing my master's program and continue my networking and taking any available opportunity to intern, gain any work experience, and just feel out the field and find where my niche is within health administration, so that when I enter the workforce, I'm more directed and I know where I want to go. And for 2021, I would be finishing, graduating, and applying to a job. And hopefully, I had made plenty of networks and contacts in the health administrative field, that I would have good guidance on where's the best places to go, and maybe even some extending of job offers from some of the contacts that I have made, and also continuing my education through certifications and further involvement within the health administrative and the student organizations that I had attended during my time as a graduate student. And that ends my presentation, and I thank you for taking the time to watch and listen.